Hi, Mr. Lowell. My name's Katie. I'm going to be your nurse today.
Hi, how are you?
Good. So as part of your wellness exam today, I just want to do an in-depth assessment of both your cardiovascular and your respiratory systems. Is that okay with you?
That's fine.
Perfect. So the first thing that I'm going to do to start this out is to just take a look, make sure everything looks normal, okay?
Okay.
Perfect. Color is good. Breathing pattern is unlabored. No visible lumps or masses. Position is relaxed. No nasal flaring. I'm going to look at your hands really quick. No clubbing of the fingernails. Color is good. Capillary refill is brisk. And skin turgor is taut. Perfect. All right, I'll have you rest your hands down by your side then. Can you tell me your full name and date of birth?
Yeah. John Russell Lowell, 1/30/1988.
Perfect. And what day is it today?
Today is Saturday.
Perfect. And then what are we doing for you right now?
We are doing an assessment.
Perfect. So I want to just first check and make sure the expansion on your chest is symmetrical on both sides. So I'm going to get down with you. So I'm going to pull your skin together, and then I want you to take a nice deep breath in and exhale. Perfect. And then I'm going to go around to the other side and make sure it's the same on the posterior side again. Good. And then I'm going to palpate just to make sure that there's no tenderness anywhere, no lumps or masses that may not have been visible, okay?
Okay.
I want you to let me know if anything feels tender, sore, painful.
Yes, ma'am.
Good. Perfect. And then I'm going to move on to something that's called tactile fremitus. So this is going to help check with consolidation. So what I'm going to do is I'm going to move my hands to certain different areas on your chest and on your back. And when I move my hands, I'd like you to say the word 99, okay?
Yes, ma'am. 99. 99. 99. 99. 99. 99.
Perfect. And then I'm going to move to the back.
99. 99. 99. 99. 99. 99.
Perfect. And that's symmetrical on all sides. And then I'm just going to look at your trachea really quick. And that's midline, no deviation. Perfect. And then I'm going to do something that's called percussion. So I'm just going to tap on different areas of your chest and on your back. You can relax and breathe normally through all of this, okay? Perfect. And then I'm going to move to the back. And this just helps test if there's any areas of density that may be signs of pleural effusion or basically any respiratory issues.
Okay.
And then I'm going to identify a couple margins that's going to make the rest of my assessment a little bit easier. So first we're going to look at your suprasternal notch, and then your sternal angle, and then we're going to follow that all the way down to your costal angle. Perfect. And then I'm going to go around the back, and then I'm going to look at your C7 and your T1 vertebra. Perfect. And then I'm going to just listen. So I'm going to listen on the front and the back. When I move my stethoscope, if you could take a nice deep breath in and then exhale, okay?
Yes, ma'am.
Perfect. And then all of these sounds are vesicular because they're in the periphery of your lungs where there's less alveoli.
Okay.
I didn't notice any adventitious sounds, no crackles, no wheezes, no issues with your lungs, okay?
Thank you.
So we're going to move on to the cardiovascular system if that's all right with you.
That works.
All right, so now we're going to move over to the cardiovascular part of this assessment.
Okay.
So first what I'm going to do is just look and palpate a couple areas really quick, okay? So
Okay.
first I'm just going to look at your carotid arteries. And I'm going to palpate those really quick. Just breathe normally. And then I'm going to look at your jugular veins, neither of which are visible right now. So I'm going to have you lay down really quickly. Internal jugular vein is visible in the supine position. And then I'll have you slowly sit up and disappears at about 45 degrees. Perfect. So then I'm just going to palpate one area. I'll have you lay back down again for that.
Okay.
And we'll lay down for the remainder of this assessment.
Okay.
So this is called your apical impulse. Look at the fifth intercostal space. Midclavicular. And it is palpable. And then I'm going to have you roll over to your left side slightly. Perfect. Again, it's palpable. Good. And I'll have you lay back and relax.
Okay.
And I'm just going to palpate the rest of your precordium. I want you to let me know if you have any tenderness at all.
Yes, ma'am.
No issues?
No, ma'am.
Perfect. All right. So this next part, I'm just going to listen to several different areas of your heart, okay?
Okay, perfect.
And just breathe normally throughout all of this.
Okay.
I'm going to listen to each section for at least 30 seconds. Heart rate is regular. S1 and S2 are identified. No S3 or S4. And no murmur. That's all normal. I'll just have you roll over slightly to your left side for me. Again, regular, no murmur. That's normal. And then I'll have you sit up.
Okay.
And then lean slightly forward for me. Alright, no changes in that either. Alright. So that actually completes our assessment today. Do you have any questions or concerns that you'd like to talk about?
No.
Perfect. Alright, well, it was a pleasure meeting you,
Thank
Mr.
you so
Lowell.
much.
Thank you so much.